Chickenpox. We all remember it, right? The itch, the spots, being stuck at home. But what if I told you that classic childhood memory is really just act one of a much longer story? What if that virus doesn't just pack up and leave? What if it actually hides out in your body for decades, just waiting for a second chance? Today, we are pulling back the curtain on the two faces of chickenpox.
So, let's meet our main character. Its scientific name is the Varicella-Zoster Virus, or VZV for short. Now pay attention to its family name, herpesvirus. That's our first big clue that this virus plans on sticking around for life. And here's a wild little detail. It only infects humans. It's a specialist, and we're its specialty.
And this is where the whole two faces thing really comes into play. See, VZV is a master of disguise. The first time you get infected, it shows up as chickenpox. But it's not a one-and-done kind of deal. Oh no, it stays, lying dormant for years, sometimes decades. And when it comes back, it reactivates as a completely different illness, shingles.
But before it can pull off this long-term trick, it has to get inside in the first place. And let me tell you, this virus is an absolute pro at spreading. So let's break down how a single sneeze can kick off a full-blown invasion.
VZV is, and I can't stress this enough, incredibly contagious. It travels through the air in tiny droplets when someone coughs or sneezes. You can also get it from touching the rash itself. But its real secret weapon? Stealth. Get this, you can be contagious, spreading the virus to others for 2 whole days before a single spot ever appears.
Okay, so once you're exposed, the clock starts ticking, but you will feel a thing. The virus enters what's called the incubation period. For the next 10 to 21 days, it's quietly multiplying inside you, building its army, all before the first real symptoms show up, usually right around that 2-week mark.
During that silent phase, the virus is on a mission. It slips in through your respiratory system, then immediately sets up shop in your lymph nodes. From there, it launches a first wave into your bloodstream. After multiplying like crazy, it unleashes a second, much bigger wave that carries it all over your body to its final destination, your skin.
And its arrival at the skin, well, that leads us to the part everyone recognizes. That classic, unbelievably itchy chickenpox rash. You know, the rash doesn't just pop up randomly. It follows a very specific pattern. It usually kicks off on your face, scalp, and torso, and then it spreads outwards to your arms and legs. This center-out pattern is a classic calling card for doctors. It basically screams chickenpox. Now let's zoom in on just one of those spots. Each one goes through this super fast evolution. It starts as a little flat red mark, then it becomes a raised bump. After that, it fills with clear fluid, turning into a blister. That fluid might get a little cloudy before the blister finally pops and scabs over.
And you know, for how annoying this rash is, doctors have this surprisingly poetic way to describe it. They call the fresh blisters dewdrops on a rose petal. It's a perfect description, right? That little clear blister sitting on top of a red patch of skin.
But here is the absolute dead giveaway for diagnosing chickenpox. It's that you see spots in all of those different stages at the exact same time. You'll have brand new red spots, fluid-filled blisters, and old crusty scabs all next to each other. This chaotic, multi-stage rash is the telltale sign of VZV.
Okay, but chickenpox isn't always just an itchy nuisance you get over in a week. For some people, especially adults, it can actually be a pretty serious and sometimes even dangerous illness.
The most common complication is pretty straightforward. Scratching the blisters can lead to a bacterial skin infection. But the risks can be much, much bigger. We're talking about things like encephalitis, which is inflammation of the brain, hepatitis, inflammation of the liver, and a really dangerous lung infection called varicella pneumonia.
And this is a really key takeaway. For most kids, yeah, chickenpox is a mild illness. But getting it as a teenager or an adult, that's a completely different story. The risk for those serious complications we just mentioned, especially that dangerous pneumonia, goes way, way up.
Just how high does the risk go? Well, for pregnant women who get chickenpox, a staggering 10 to 20% will develop varicella pneumonia. Think about that. That's as high as a 1 in 5 chance of a life-threatening complication. And beyond just the risk of pneumonia for the mother, if she gets infected early in her pregnancy, the virus can actually cross the placenta. In some rare cases, this can cause a devastating condition in the newborn called congenital varicella syndrome.
So, knowing all these risks, how does modern medicine actually manage and, more importantly, prevent this two-faced virus from causing so much trouble?
All right, so how do we fight back? Well, the game plan really depends on who gets sick. For most healthy kids, it's all about comfort care. Stuff to reduce the fever and control that maddening itch. But for teenagers, adults, or anyone with a weak immune system, doctors bring out the big guns. Antiviral medications like acyclovir to shorten the illness and head off complications.
Okay, and this next part is a critical safety warning, so please listen up. You should never, ever give aspirin to a child who has chickenpox. It's linked to a rare but incredibly serious condition called Ray's syndrome, which can cause severe damage to the brain and liver.
Of course, the best treatment of all is just not getting sick in the first place. And that's where the chickenpox vaccine comes in. It uses a weakened but still live version of the virus, and it is our absolute best defense. It's usually given in 2 doses to kids, but adults who never had it can get it too.
But what happens if someone who's at high risk gets exposed before they can be vaccinated? Well, there's an emergency backup plan. It's an injection of something called VZIG. It's basically a dose of pre-made antibodies that gives their body the weapons it needs to fight off a serious infection.
And this brings us right back to where we started. Because whether you actually got sick or you just got the vaccine, the Varicella-Zoster virus never truly leaves your body. After the initial battle is over, it retreats. It goes into hiding deep inside your nerve cells, where it just lies there, dormant, waiting.
So the rash is gone, the itching is stopped, but the virus is still there. It's like a tiny ticking time bomb sleeping in your nervous system. The first battle